So I'm going to just do a quick overview of the anatomy of the knee in about 3 minutes. So the knee is a hinge type synovial joint connecting the femur to the tibia. It's one of the largest and most complex joints in the body, allowing flexion, extension, and slight rotation. So on the femur, the distal end, we have the medial and lateral condyles, and these articulate with the tibia. We have the medial and lateral epicondyles, and these are attachment sites for the collateral ligaments, the MCL and the LCL. We have the adductor tubercle, which is the insertion of the adductor magnus, and we have intercondyle fossas, which houses the cruciate ligaments, so ACL and PCL. We also have the patella surface, and this is grooves where the patella will sit and glide. So let's have a look at the tibia. We have the medial and lateral condyles that articulate with the femur. We have the tibial plateaus, which is the weight-bearing surface of the tibia. We have the intercondyle eminence, which attachment sites for ACL and PCL. We have the tibial tuberosity, which is the insertion point of the patella ligament. We have the pons anserinus area, which is the insertion for sartorius, gracilis, and semitendinosus. Then if we have a look at the fibula, which is on the lateral side, and it's a non-weight bearing bone. We have the fibula head, which is the attachment site for the bicep femoris and the LCL, so the lateral collateral ligament. We have the neck of fibula. So this is the location where the common fibular nerve passes around. We then have the patella. So we have the base and apex of the patella, and that attaches to the quadricep tendon and the patella ligament. We also have articulating surfaces, and that slides within the femoral groove. So let's have a look at muscles acting on the knee. So we have our knee extensors, which are found on the anterior aspect of the thigh, and these are our quadricep group that all perform knee extension, except rectus femoris, which also assists in hip flexion. Now all the quads insert into the patella via the quadricep tendon, then into the tibia tuberosity via the patella tendon. Then we have knee flexors. These are found on the posterior aspect of the thigh, and these are the hamstring group. So they all flex the knee. But bicep femoris also laterally rotates the knee, as well as semitendinosus and semimembranosus. They will medially rotate the knee. Now, they all originate from the ischia tuberosity and cross the knee to insert on the tibia or the fibula. Then we have other muscles that will impact knee movement. So we have the gastrocnemius, and this assists in knee flexion and plantar flexion of the ankle. We have the popliteus muscle, and this unlocks the knee from full extension by medially rotating the tibia. We also have the sartorius, the gracilis, and the semitendinosus, which contribute to flexion and internal rotation, and these all insert into the pons anserinus area. So within the knee, we also have supporting structures. So we have ligaments, and there are four main ligaments of the knee: the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral ligament, and the lateral collateral ligament. We also have menisci, and they sit on the tibial plateau, and they're mainly shock absorbers, and we have a medial and lateral side to them. And then we have the bursae, and there's quite a few in the knee, including the suprapatellar, prepatellar, infrapatellar, and pons anserinus bursae. It's always really important to link anatomy back to clinical relevance. Now, injuries such as ACL tears, menisci damage, or kind of overuse injuries are common due to the high stress placed on the knee in sport and daily activities. Now, understanding both the muscular and bony anatomy is essential for assessment, treatment, and rehabilitation.